Hello viewers, today we will discuss food and nutrition. In this segment, the topic we will cover today is the National Nutrition Program. The objectives of this session is to know about the various nutrition programs in India, to create awareness about the programs that are implemented, to combat malnutrition through national nutritional programs. Malnutrition is widely prevalent among low-income groups of the population in almost all developing countries. The problems of nutrition in India are enormous and complex. Poverty is the major cause of undernutrition. There are also socio-cultural factors that have kept a large segment of our population below adequate level of nutrition. Despite substantial progress in human development since independence, more than half of the children under the age of 4 years are inadequately or severely malnourished. 30% of the newborns are significantly underweight and 60% of Indian women are anemic. A sure way of overcoming the problems of undernutrition is to enable the people to consume a balanced diet through improvement of their purchasing power and nutrition education. But they are long-term and laborious processes and beyond the direct purview of health and nutrition agencies. To prevent certain specific nutritional disorders, several action programs in the recent years have been undertaken by the government agencies. These include short-term emergency measures because this is not the only way to eradicate the problems of malnutrition from the country. However, they can be relied upon to be effective in reducing the quantum of severe forms of malnutrition, thus help in bringing down the death toll and for disability due to malnutrition. The first 5-year plan recognized the need to combat the ill effects of malnutrition. Some programs were initiated during the 3rd and 4th 5-year plans, which did not make the desired headway. Since improving the nutritional status of the population intended is to be a long-term measure, certain nutritional programs suitable for immediate relief were started during the 4th 5-year plan and intensified in the 5th plan. The scope of these programs was expanded to cater the needs of pregnant and nursing mothers, preschool children belonging to weaker sections who account for about 40% of total population. Malnutrition, being a multifaceted problem, needs a combination of approaches like supplementary feeding, nutrition, education fortification and enrichment of foods, extending the existing food supplies and health measures which are being emphasized in policy making and program implementation. It would be appropriate to know various nutrition programs being implemented in the country today. National nutritional programs in India. After independence, in the first phase, threat of famine and the resultant acute starvation due to low agricultural production and the lack of an appropriate food distribution system, there was chronic energy and micronutrient deficiencies due to low dietary intake because of poverty and low purchasing powers, high prevalence of infection because of poor access to safe drinking water, sanitation and healthcare, poor utilization of available facilities due to low literacy and lack of awareness. In the second phase, the food production phase in the 1940s. Over the past few decades, India attained self-sufficiency in food production. In 1970, through various interventions, namely Green Revolution, Public Distribution System, R&D in the field of nutrition by NIN and CFTRI. The third phase was called the community phase. This involved direct interventions through nutritional programs in 1960s and early 70s with the inception of the 5-year plans. A number of short-term measures to combat problems of malnutrition, undernutrition is found mostly in rural areas. A number of agencies were formed to address this issue, like Ministry of Rural Development. Ministry of Human Resources Development had an integrated child development services scheme with Balwadi nutrition programs and special nutrition programs. Ministry of Health and Family Welfare also started National Nutritional Anemia Prophylaxis Program, National Prophylaxis Program for Prevention of Blindness due to Deficiency of Vitamin A, and National Iodine Deficiency Disorder Control Program. The Ministry of Education and the Midday Meal Program. This was one of the earliest nutritional programs. This project was started in Odisha in 1963. It was later extended to Tamil Nadu and UP. Objectives of these programs were to promote production and to protect food such as vegetables and fruits, and to ensure their consumption by pregnant and lactating women and children. In 1973, it was extended to all states in India. Services provided by the ministry were nutrition education. Nutrition were 25 paise for children and 50 paise for pregnant and lactating women was to be given for 52 days in a year. The program maintained by Ministry of Rural Development was Balwadi Nutritional Program. This was started in 1970 under the Department of Social Welfare through voluntary organizations. Voluntary organizations receiving the grants are responsible for running this program. The beneficiaries of this group are preschool children between the age of 3 to 5. This program provided 300 kcal and 20 grams protein for 270 days in a year. It also provided preschool education. Balwadis are being phased out because universalization of ICDs. Special Nutritional Programs Integrated Child Development Services Scheme. This was initiated on 2nd October 1975 in 33 CD blocks under the 5th five-year plan under the aegis of Ministry of Social Welfare. In succession to the objectives of National Children's Policy, August 1974, this was the world's largest program for early childhood development. Objectives of the program were to lay the foundation for proper psychological, physical and social development of children, to improve the nutritional and health status of children, to reduce incidence of mortality, morbidity, malnutrition and school dropouts, to enhance the capability of mother and family, to achieve effective coordination among various departments. Beneficiaries of these programs were children up to 6 years of age, pregnant and lactating women, women in reproductive age group between 15 to 44 years. To achieve the objective, the following package of services was provided. Beneficiaries group and services provided. Pregnant women got a routine health checkup, immunization against tetanus, supplementary nutrition, nutrition and health education. Nursing mothers got a health checkup. They also got supplementary nutrition and nutrition health education. Women between the age group of 15 to 44 years got nutrition and health education. Non-pregnant and non-nursing women and children below 3 years of age were given nutrition and health education. Supplementary nutrition includes immunization, health checkup, referral services. Children in the age group were given supplementary nutrition between 3 to 6 years. They were also given immunization, referral services, non-formal preschool education. Efforts are also being made for safe drinking water supply, functional literacy for adult women, and mobile food and extension units in ICDS project areas. Administration of this scheme is also provided for community development, block rural areas, tribal areas, wards, slums, urban areas. Supplementary nutrition is also provided. Supplementary feeding and growth monitoring, prophylaxis against vitamin A deficiencies, control of nutritional anemia, activities, target groups identified from community. They are provided supplementary feeding support for 300 days in a year. Weight for age growth cards are maintained for all children up to 6 years of age. Severely malnutrition children are given special supplementary feeding and referred to medical services. Wheat-based nutrition program was launched in 1986. This was a centrally sponsored program. It was implemented by the Ministry of Women and Child Development. It follows the forms of SNP. It provides nutritious energy food to children below 6 years of age and expectant and lactating women from disadvantaged sections. Implemented through ICDS, food grains supplied under the program used to prepare food for supplementary nutrition in ICDS. Nutritional program for adolescent girls. This was introduced in the year 2002-2003 with 100% central assistance. Aims of this program were to improve nutritional and health status of adolescent girls, provide nutrition and health education to the beneficiaries, empower adolescent girls through increased awareness to take better care of their personal health and nutrition needs. Beneficiaries: adolescent girls had to weigh about 35 kgs and pregnant women had to weigh about 45 kgs. Services: 6 kg ration per month for 3 months consecutively was provided. This was implemented through the AW centers. The recipients were weighed 4 times in a year. Based on the body weight, they would be issued rice for 3 months. ICDS has a total of 230 blocks. A total of 8,08,118 number of AWCs are functioning today. Feeding days covered in 2011-12 was 177 days. Target was 300 days. Food sponsored for program. 90% of the budget in the Northeast states. Beneficiaries were children from 1 to 5 years of age, expecting and lactating mothers, family planning, IUD acceptors. Policy: expecting and lactating mothers as well as IUD acceptors were given 60 milligrams of elemental iron plus 0.5 folate every day for 100 days. Children between 1 to 5 years, 200 milligrams of elemental iron plus 0.1 mg of folate every day for 100 days. A program in the pursuit of prevention of anemia in the country was launched in 1991, renamed as National Nutritional Anemia Control Program. The beneficiaries were redefined and it was extended to both anemic and non-anemic, lactating, expecting mothers and children from the age of 1 to 5 years. A dosage of iron from 60 mg to 100 mg of elemental iron was given daily. In 1992, the program was made an integral part of CSSM program. 100 mg Fe plus 0.5 folate for 100 days was started along the first dose of injection tetanus. Therapeutic dose of 2 tablets of Irofol for 100 days was provided for this group. In 1997, the program was integrated with RCH. In 2005, the program is now integrated with NRHM. 2007, new directives from Ministry of Health and Food and Welfare, Government of India. 6 to 12-month infants were to be included in this program. A dose for under 5 children in liquid formulation was to be given. Children between the ages of 6 to 10 and adolescents between 11 to 18 years included. Recommended dosage: 6 to 59-month children, liquid 20 mg, Fe plus 0.1 mg folate for 100 days. 6 to 10 years, 1 tablet 30 mg, Fe plus 0.25 mg folate for 100 days. Adolescents and adults, 1 tablet 100 mg, Fe plus 0.5 mg folate for 100 days. Folic acid tablets are given in the first trimester and first 4 weeks for pregnant mothers. Weekly iron and folic acid supplementation programs for adolescents, also known as WIFS, the Blue Campaign. Nodal agency was the Ministry of Health and Food Welfare. The beneficiaries were adolescent girls and boys enrolled in school in the 6th to 12th standard. Adolescent girls not enrolled in the schools were also included in the program. The services provided were IAF tablet to target population on weekly basis on a fixed day, Monday, for 52 weeks was given. A biannual deworming, February to August, was also given. National prophylaxis program against nutritional blindness due to vitamin A deficiency. This program was launched in 1970 as a centrally sponsored scheme by the Ministry of Health and Food and Welfare, Government of India. A major component of National Program for Control of Blindness in 1976. The target group was all children between the age of 1 to 3 years. Activity was a mega dose of vitamin A orally given every 6 months. National Iodine Deficiency Disorder Control Program. This program started in Kangra Valley after a study between 1956 to 1972. A national goiter control program was launched in 1962 at the end of the second 5-year plan by Ministry of Health and Food and Welfare, Government of India. This program focused on the use of iodized salt, replaced common salt with iodized salt, one of the cheapest methods to control IDD. The use of iodized oil injection to those suffering from IDD, oral administration as prophylaxis in IDD severe areas. The turning point, meeting of Prime Minister in 1983. In 1983, universal oxidization of salt was initiated. In 1992, the program was renamed as National Iodine Deficiency Disorder Control. Objectives of the program were to survey, to assess the magnitude of IDD, supply of iodized salt, resurvey every 5 years to assess the impact of iodized salt and IDD, lab monitoring of iodized salt and IEU and health education. The strategy was to iodize entire edible salt in the country by 1992. A ban of non-iodized salt under PFA Act 1954. Midday Meal Program. The Midday Meal Program was first introduced in Tamil Nadu. It was also known as School Lunch Program. This program has been in operation since 1961 under Ministry of Education. The aim of the program is to provide at least one nourishing meal to school-going children per day. Objectives were to improve school attendance, to reduce school dropouts, for beneficial impact on child's nutrition. Principles: supplement and not a substitute to home diet, supply at least 1/3 of the energy requirements and half of the protein needed. The cost of the meal would be reasonably low. Meals prepared easily in schools, no complicated cooking procedures. Locally available foods were to be used. The menu would be frequently changed. Akshaya Patra. This program was initiated in 2000, feeding 1,500 children in 5 schools in Bengaluru. This successfully involved the private sector participation in the program. The program managed with a centralized kitchen that runs through public-private partnership. Food was delivered to schools in sealed and heat-retaining containers just before lunch break every day. The objectives of this program was to provide underprivileged children with a healthy, balanced meal, to reduce the dropout rate and to increase classroom attendance, to improve socialization among caste, address malnutrition, and to empower women through employment. Summary of this program is to prevent certain specific nutritional disorders. A number of action programs in recent years have been undertaken by governmental agencies. These include short-term emergency measures because by no other means it can be expected to eradicate the problems of malnutrition from the country. However, they can be relied upon to be effective in reducing the quantum of severe forms of malnutrition, thus help in bringing down the tally of death toll and for disability due to malnutrition. The scope of these programs was expanded to cater to the needs of pregnant and nursing mothers, preschool children belonging to weaker sections who account for about 40% of the total population.